Other sticking points in the shutdown talks is the fight over expiring federal health credits. Democrats say their goal is to save health care tax credits to avoid millions of people losing health insurance through the federally subsidized marketplace. Republicans argue it's time to end the pandemic-era credits of the constantly growing federal obligation towards the Affordable Care Act plans. So let's bring in former CDC Director during the Obama administration and author of The Formula for Better Health, How to Save Millions of Lives, Dr. Tom Frieden, for more on this. So Dr. Frieden, thank you so much for being here. So as I just mentioned, you were appointed by President Obama. You were headed the CDC when the Affordable Care Act was put into place. What happens if those tax credits expire?
What we're seeing really is an assault on health in the U.S. I was the CDC director during that 13-day shutdown that you just mentioned, and it was a terrible time where our health protections were weaker. Americans were less safe. When it comes to health care coverage, when people have to pay more for health care or get less from health care, it means we're less healthy, we're less safe. And what we're seeing is really a pretty steady assault on our health protections.
And Dr. Frieden, Democrats are also calling for the reversal of Medicaid cuts from the tax and spending bill that the president had signed into law earlier this year. So talk about the stakes here. What happens to the American people if those cuts are not reversed?
There's a bottom line here, and today the book, as you mentioned, The Formula for Better Health, How to Save Millions of Lives, including your own, publishes. And I talk about seeing things that aren't apparent. And one of the things that's not apparent is that if, as the Budget Office and others predict, more than 15 million people will lose health coverage in the coming years, that's not just about people who have to pay more. That's about deaths that will happen that are preventable. Deaths from heart attacks and strokes and cancers and infections that are preventable. We have the means to save millions of lives, but if we undermine our healthcare system, if we undermine those protections, then we're at greater risk.
And if the government does shut down at midnight, there will be impact to some services at Health and Human Services. So how would Americans be affected by that?
It's very hard to predict exactly what will happen. When I was CDC director during that 13-day shutdown, I walked through laboratories that were empty with alarms going off. We were not able to track foodborne illness and other diseases that could affect whether the food you buy in the supermarket is safe. If there's an outbreak in your community, it may not be addressed or assessed or stopped. So public health is about all of us. It's about keeping us safe and giving us the ability to live longer, healthier lives. And when we undermine that, we undermine our own health.
And earlier you mentioned your new book, The Formula for Better Health, How to Save Millions of Lives. What do you want people to take away from your book?
Progress is possible. Public health has saved millions of lives in the past, and there's an approach, a proven approach, that can save millions more, including your own. That approach is to see the invisible, believe that what may seem inevitable actually can be changed, and then work together to create a healthier future. And that's possible by overcoming the barriers that face progress, whether it's in preventing diseases of cancer or heart disease or infectious diseases. We can make progress. There's a way, it works, and this is one approach that's been proven and that's relevant not just for our communities, but also for each of us as individuals.
Former CDC Director Tom Frieden, thank you so much.
Thank you.